Hello friend, today we will discuss about typhoid fever, which is also known as enteric fever. It is prospectively multisystemic illness that has been public health problem, especially in the developing world, caused by Salmonella typhi and Salmonella paratyphi. Enteric fever, also known as typhoid fever. Typhoid fever is an acute illness associated with fever caused by Salmonella typhi bacteria and also be caused by Salmonella paratyphi related to bacterium that usually cause a less severe illness. Major cause morbidity, waterborne disease. Causes bacteria. It is caused by bacteria Salmonella typhi family, Enterobacteriaceae, gram-negative bacilli grown at 37 Celsius. Transmission, fecal-oral route, closely contact with patients or carriers. Contaminated water and contaminated food, flies and cockroaches. Typhoid. High risk is the red line, median and the low risk map shows the ratios of typhoid fever. Malaysians, females, and district of Kota Beri. Is typhoid contagious? Typhoid fever is highly contagious. An infected person can pass the bacteria out by their body in their stool as well as commonly in their urine. How does people get typhoid? Work on a travel area where typhoid fever is endemic. Work as a clinical microbiologist handling Salmonella typhi bacteria. Have closely contact with them. How long persons with typhoid fevers? What is the prognosis of typhoid fever? With appropriate antibiotic therapy, most patients recover from a disease. However, 30% people who do not receive therapy will die annually. In the United States, there is a 300 to 400 cases, only 1 2 deaths each year. Most of those who get sick had failed to receive a vaccination prior to travel. Commonly, multi-antibiotic resistant strain of bacteria become more common worldwide. Pathophysiology: ingest contaminated food, ingest bacilli in weird small intestine, regional lymph nodes, Salmonella typhi multiple in intestinal lymphoid tissue, intact enterobacteriaceae, and also then pass the intestinal tract. Where are the symptoms of typhoid fever? Incubation period is typhoid fever 10 to 14 days but can be longer, and the onset may be indigenous. Symptoms are often non-specific and clinical non-distinguished. Clinical features: Stage 1: slowly rising step-ladder fashion on the temperature for 4 to 5 days, abdominal pain and myalgia, malaise, headache, constipations, relative bradycardia. Stage 2: second week, sign and symptom first week progress, second end of second week, delirium, complication, then coma, death, end of first week. Rose spot may appear on the upper abdomen and black spears, cuffs, splenomegaly, abdominal distensions, and tenderness. Diarrhea must be included. Rosy spots, slightly raised red cells. Stage 3: febrile become toxic and anaerobic, significantly weight loss. Paratyphoid. Typhoid fever symptoms: high fever, headache, thickness, weakness, dry cough, and constipations and rashes on the body. Complication: bowel, preference, hemorrhage, septicemic fecal, bone and joint infection, toxic pneumonia, and chronic carriage. Diagnosis and investigation: blood culture, specific serological tests identify Salmonella antibodies, antigens, fluorescent antibodies study to look for substances that are specific to typhoid fever. Viral test and ELISA, urine and stool second and third week. Marrow culture, less than 90% sensitive unless after 5 days commence of antibiotic. Punch biopsy 63%. Clot culture. Serology, Vidal test, tube agglutination test detects O and H antigen, diagnosis of typhoid and paratyphoid test, H antiglutinin and dryers, tubes are narrow tube fluke leads the bottom, testing for O glutinins on flex tubes. Other non-specific tests: monohydrate anemic, Moderate anemic, increased ESR, thrombocytopenia and lymphopenia, slightly elevated PT and APTT, decreased fibrinogen level, liver transaminase and bilirubin increased to multiply, ALT level and LDH increased, typhoid specimen collection based on different enteric fever. First week blood culture 90% positive. Second week blood culture, feces culture, vital test 50% and 70% and low titer. Third week vital blood culture fecal 80 to 160 and 80. Treatment activity rest in helpful medical care, antibiotic, corticosteroids, antipyretics. Diet fluid of electrolytes should be monitored. Soft and surgical care in case of intestinal proliferations. Antibiotics chloramine, phenicol, ampicillin, trimexaol, fluoroquine, drug of choice ciprofloxacin. Treatment should be continued for 14 days. Chronic caries may be formally treated for 4 weeks with ciprofloxacin but may require an alternative agent during a guide of antimicrobial sensitivity testing. Cholecystectomy be also prescribing. Typhoid fever preventions. Typhoid preventions. Wash and drink boiled water, clean fruits and vegetables, get vaccinated properly. Reference